color who, here in King County and across the US, have suffered the highest rates of COVID-19 cases, hospitalizations, and deaths. It's appropriate that the observance of Juneteenth is now a national holiday and will be officially recognized as a paid holiday in King County beginning next year. It serves as both a cause for celebration and as a needed reminder that we have much work yet to do to realize a more equitable and just society. Today, I particularly want to thank the many Black and African American run media outlets who join us, including Rainier Avenue Radio, Seattle Medium, The Facts, South Seattle Emerald, Converge, Runta News, The Scanner, and Somali Bridge, for your work to provide information to your viewers, readers, and listeners that can improve and enrich the lives of Black and African American community members in King County. On with the update now. Today's forecast is for increasing sunshine in many areas, with some potentially stormy weather in others. If you're vaccinated, you'll see mostly sunny skies, although if you're unvaccinated, it's likely you'll get rained on and possibly experience some thunder and lightning. New cases and hospitalizations have been decreasing since early May. Over the last 7 days, we've been seeing about 79 new cases daily, which is down by 81% from our recent peak of 432 cases a day in late April. Comparable to number of cases occurring, this number is comparable to the number of cases that was occurring before the large fall and winter third wave, and about twice the number of cases last year at this time. COVID-19 cases continue to decrease for all age groups, with the highest rates now in children and young adults, followed by middle-aged adults. The 14-day incidence rate is currently 62.9 per 100,000, and we fall into the CDC moderate transmission category as a county. The rate of COVID-19 in children and young adults under 35 is about 2.5 to 3 times the rate for people 65 and older. And COVID-19 is falling throughout the county, but continues to spread at the highest rates in the cities in the South and Southeast King County, with Auburn, Kent, Federal Way, Burien, Renton, Tukwila, SeaTac, West Seattle, South Seattle, Delridge, Highline, and Southeast King County, where COVID-19 rates are 3 to 4 times higher than they are in Central and North Seattle and the East Side. Hospitalizations have fallen by over 3/4 from our late April peak of 23 a day to 5 a day recently. That's one person in our county hospitalized for COVID-19 every 5 hours currently. The 7-day hospitalization rate is currently 2.1 per 100,000, which is approximately twice what it was last year at this time. And we continue to report 1 death a day, comparable to what we reported last year at this time. In summary, case, hospitalization, and death rates have fallen dramatically since our spring 4th wave, and as more and more people have been vaccinated. And although COVID-19 infection rates are much lower than recent peaks, COVID-19 is not gone. We still have about twice the number of cases occurring as we did a year ago before our summer 2020 peak, and about the same number as before our large third fall and winter surge. Rates of hospitalization are relatively low, but still about 50% higher than what they were a year ago and before the fall and winter surge. And we have more dangerous variants of concern increasing, most recently the Delta variant. However, today, when so many of us are protected through vaccination, we're much less vulnerable to large surges in hospitalizations and deaths that we saw earlier in the outbreak. But COVID-19 can still cause plenty of trouble among the unvaccinated. Today, 95% of all COVID-19 cases, hospitalizations, and deaths are occurring in people who are not fully vaccinated. There are disparities that are continuing by race and ethnicity. New cases and hospitalizations are decreasing more slowly in certain racial and ethnic groups compared to the county as a whole. For example, for King County overall, COVID-19 cases have dropped about 80% since peaking in late April. But for Native Hawaiian and Pacific Islanders, cases have decreased 66%. And for our Black African Americans, cases have decreased 54%. In fact, 27% of all new cases last week were in Black and African American residents, the highest proportion since COVID hit King County, and especially disproportionate given Blacks and African Americans represent only 6% of the King County population. Black, African American, and Latinx residents have vaccination series completion rates that are about 50%, which is the lowest of any racial and ethnic groups in King County. And this contributes to much of the disparity in disease rates we're seeing currently. And on this point, I want to again thank the many Black and African American-led community organizations and our Hispanic community organizations that are working to answer questions about vaccination and help people make the best choices to protect their health, the health of their loved ones, and their community members, and by making vaccine accessible to these people. And finally, it's important to note that the racial and ethnic groupings that we use for public health epidemiological analyses do not represent a single group. These are not homogeneous monolithic groups. Each includes a diversity of communities, of language groups, cultures, and religious identities. So please use caution in generalizing from these findings. Now I want to speak a little bit about the variants of concern. About 90% of COVID-19 samples sequenced in Washington state are now variants of concern. This means if you're unvaccinated, the viruses you're likely to encounter are more contagious and can cause more severe illness than what was circulating in most of 2020. In King County, the Alpha or B.1.1.7 variant is the most prevalent, followed by Gamma or P1 and the new fast-moving Delta, B.1617.2. Delta is particularly worrisome as it's even more contagious than the other more contagious variants. It may cause more severe illness and has a greater impact on protection from vaccines, and that protection after the first dose of a 2-dose series is significantly lower than with other strains. So getting 2 doses on time is even more important for full protection against Delta. Now, I want to be clear that our vaccines offer excellent protection against Delta and the other current variants of concern, but the complete series is required for Delta. It's also required for the others, but to a lesser extent. If you want to be protected, and you should, remember it takes 5 to 6 weeks after the first dose for full protection. So waiting to be vaccinated until Delta takes over as the most prevalent variant is not a good idea. Get vaccinated sooner rather than later to get the best protection. Now, last Tuesday, we reached a milestone with 70% of residents in King County, age 16 and older, having completed their vaccine series and 78% having received their first dose. We're also now at 77% with the first dose and 70% completed for residents 12 and older. Now, these completion rates vary by age, with about half of 12 to 19-year-olds, 56% of 20 to 29-year-olds, and 65% of 30 to 39-year-olds vaccinated currently. And as I mentioned, about 52% among Black and 54% among Hispanic community members compared to 67% for whites. Now, all racial and ethnic groups have 70% or more completed in their 50 and older community members, and in all racial and ethnic groups, there's an over 80% completion rate for those 65 and older. So that's fantastic in protecting the most vulnerable across our community. However, vaccination rates continue to lag in South and Southeast King County, and these are the communities that have had the highest COVID-19 disease rates as well. So we've still got more work to do. Our goal is to reach a minimum of 70% fully vaccinated within all racial and ethnic groups and in all zip codes, and ultimately have as many people as eligible vaccinated in King County as possible. We have community-led organization, community of color-led organizations, community clinics, and businesses have been key to our vaccine strategy by sharing vaccine safety information and providing vaccinations in trusted environments. We are grateful to the many organizations and community members who are essential in this vaccination effort. For example, we've recently partnered with Black Power Unlimited and Harborview Medical Center to host a vaccine clinic at the historic Washington Hall in Seattle's Central District. And that was tailored to the Black and African American community. And these types of events will continue. We also will continue efforts to reach younger residents. Large efforts to date to bring vaccination into school settings, as well as partnering with employers to provide vaccination on site will continue. And our mobile teams continue to serve people who are homebound, people who are living homeless, and now increasingly holding vaccination events at bars, employment sites, sporting events, and other venues. To date, our mobile teams have administered over 52,000 vaccine doses, and we've also adjusted the hours at our high volume vaccine clinics to provide better weekend coverage. In the coming weeks, I'm sure you're aware, there will be some changes to both our local and state COVID prevention guidance, and I'll just briefly cover this. The mask directive here in King County will be lifted on June 29th, 2 weeks after we met the 70% milestone for residents 16 and older vaccinated. They will be considered fully vaccinated and my mask directive will end. When this ends, Washington State and CDC mask guidance will be in effect. The goal of the King County directive was to further reduce community risk for everyone before transitioning to the new CDC mask guidance. And on that front, I think we were successful because in the month since the local directive was issued, we've had 170,000 people aged 16 and older who completed their vaccine series, and another 130,000 first doses were administered to people of all ages. Our incidence rates in the county dropped 66%, and hospitalizations due to COVID dropped 70%. So today, although the likelihood of encountering COVID-19 is lower, people who are unvaccinated remain at higher risk, both for getting sick from COVID-19 and spreading the infection to others. So anyone who is not fully vaccinated needs to continue to wear masks in public and take other precautions to prevent the spread of COVID-19, including limiting indoor activities with unvaccinated people and physical distancing. And everyone will continue to need to wear masks in certain settings, such as on public transportation, correctional facilities, homeless shelters, and healthcare settings, in schools, and other areas with unvaccinated children. Businesses and workplaces can require customers and workers to wear masks, and some unvaccinated people may choose to continue wearing a mask if they are at increased risk for severe infection or have an underlying health condition or in close contact with someone at increased risk. So the bottom line is that on June 29th in King County, masks will be required in most settings only for unvaccinated people and in some settings for everyone, while vaccinated people can choose to wear masks where they're not required based on their own personal comfort level. And at the state level, with vaccination rates increasing, the state has communicated that they will proceed with the reopening on June 30th or earlier. For example, there will be changes to the number of people who can be in indoor spaces or how far they must be spaced, with the exception of large events with more than 10,000 people. Let me repeat that. I think there's a word missing. For example, there will be changes to the number of people who can be in indoor spaces and how far they must be spaced, meaning that the limitations on those types of settings will be no longer required except for the largest venues. Employers and organizations may request or require proof of vaccination to attend events or return to work, and reasonable accommodations are required for those with disabilities or who can't be vaccinated. And please look to Washington State Department of Health for more information about the state's reopening guidance. So with that, I'll pause and welcome your questions.
Thanks so much, Dr. Duchin. As a reminder, if you have a question, please use the raise your hand function in Zoom and we'll call on you. And first question comes from Mayor Grewal.
Hi, Dr. Duchin. I'm Mayor Graywell from Worth a Shot, and I just want to say congratulations to King County for achieving this milestone of 70% fully vaccinated. So, Dr. Duchin, my question is, we heard about the 60 million doses that Johnson & Johnson was asked to throw out by the FDA. So can you please tell us more about what happened and how do we know that the production of this vaccine adheres to the required safety standards?
Well, Mayor, thank you for the congratulations. I think all the credit is due to the people in the county who came forward for vaccination, who recognized the importance of protecting themselves and the safety and effectiveness of these vaccines, and to all like yourself and our other healthcare system and community partners who helped get vaccinations to those who wanted them. With respect to J&J, these are doses that were produced at a certain manufacturing plant, not the same plant that is producing the doses that are currently available, that have been available, and that will be available. Production problems in that plant became known to the FDA, who inspected and immediately closed production, and those doses did not make it into circulation. So going forward, we will continue to have the supply of doses from production facilities that have been inspected and shown to be just fine with respect to quality, and there's no concerns about either J&J or any of the other manufacturing quality assurance at this point.
Thank you, Dr.
Yeah, the doses that were discarded were never used. Those lots were never used.
Next question comes from Jessamine McIntyre.
Good afternoon. Thank you all. I will echo the congratulations as well. And I know that there are many, many people who are not on this call who are involved in it. So congratulations. It's pretty great. My question actually has to do with the variants. When Dr. Lindquist talks about it on a regular basis, he said we're sequencing at 11% right now, which is leaps and bounds above any other state. So you're seeing more and more variants. And yesterday, your King County Public Health Director said that we're seeing 5 to 6% in the county right now of the Delta variant. And so I guess my question is, with the high vaccination rates, especially in King County right now, do you think we're outpacing that variant of concern before it could do something like it did in the UK?
Yeah, thanks, Justin, for that question. So a couple of things, although Washington State is one of the leaders nationally in the number of COVID-19 test specimens that get sequenced, 11% is not everyone. So we really are looking at a snapshot. That's a very good representative sample, but it's not everything. So based on that sample, we know that the vast majority of isolates in the state are variants, and that over time, certain ones are becoming more prevalent. Initially, we saw the B117 or alpha take over from the original strain that caused the outbreak last year. And then over time now, other variants that are even more effective at spreading and causing illness have come into the picture. In particular, the P1 variant, which is making up about almost 20% of our local isolates. And now, most recently, the Delta variant. And the Delta variant moves faster than any of the previous variants. It spreads more readily. Again, this is an airborne disease. This virus can linger in the air where someone who's been infected has been present. It can spread where there's not good ventilation and where people aren't wearing masks, particularly to the unvaccinated. So the reason we're concerned is that there are a significant number of unvaccinated people, and they will ultimately become infected. It's just a matter of time unless they get vaccinated. It's hard to say how quick, the variant will move here in the US. I mean, clearly, we have had more vaccinated people at the time this variant was introduced than they did in the UK. And certainly this variant developed in India, where a low proportion of people were vaccinated. But I think that, the people who are currently unvaccinated will remain very susceptible to outbreaks. And, again, there's a lot of factors that go into transmission besides the virus. It's human behavior, how close we interact with one another, particularly our unvaccinated community members, the type of interactions that they have, whether they're indoors or whether they're outdoors, and whether there's adequate ventilation and air quality indoors. So all these things sort of play together in determining how much disease we'll see due to the Delta variant. The complicating factor is these factors all change over time. Each of these change over time. And I'm particularly worried about fall, when people will be doing more gathering indoors, and the weather changes and some of these mysterious factors around virus transmission, seem to favor the spread. It's also possible we'll see outbreaks this summer over Delta, but I really can't predict, to what extent, whether we are outpacing the virus or whether the virus will outpace us. I mean, again, if you're vaccinated, we've already won, right? If you're vaccinated, you're protected against Delta and the other circulating variants. So the race and outpacing is really the pace of vaccination among those who are currently unvaccinated. And to the extent that people decide to get vaccinated now because they are understanding that there's a more contagious virus that can cause explosive outbreaks, more outbreaks mean more cases, more hospitalizations, more deaths, workplace outbreaks, outbreaks in other places where people congregate who aren't vaccinated, faith-based businesses. All of these can happen. It's impossible for me to predict, the exact pace of what may happen. But I encourage folks to get vaccinated because to the extent that we get vaccinated, we will minimize the risk for these types of transmission events and future outbreaks among unvaccinated populations. That was long.
Thank you. Next question comes from Tammy Mutasa.
Good afternoon, everybody. Hi, Dr. D. Thank you so much for your time, as always. My question is looking forward to reopening at the end of this month and the mask mandate ending, or the mask directive ending here in King County. Talk to us about how is King County preparing for this? How should people be preparing, both mentally and all the ways that you can prepare for this? Because I can imagine that there's some sort of anxiety, like we've gone through this really traumatic pandemic and now everything is kind of reopening. So how do people prepare? How are you guys preparing? Thank you.
Thanks for your question. I'm going to address some of these points in my closing statements, but in general, I think people need to understand, right now, the virus is suppressed, but it's not eliminated. The virus is still circulating, and in fact, it's better at causing disease and spreading from person to person than it's ever been. So as we relax our precautions, we understand that the only reason we're able to do this is because of our high vaccination coverage rates. And to the extent that people are vaccinated, they're protected. To the extent that people are not vaccinated, they have to understand that this virus can still infect them and spread to others. And because no vaccine is 100% protected, it's a fact that the level of transmission in the community really affects everybody. The less transmission we have, the better off we all are. Now, what we need to know going forward, of course, is that we're not going back to pre-COVID. We're going back to vaccinated people close to pre-COVID. Unvaccinated people continue to take the same precautions you've been taking. Unvaccinated people continue to wear masks when around others in indoor spaces. Unvaccinated people continue to limit your activities in indoor air spaces around others, and to understand that you are able to acquire and spread this virus before you develop symptoms, or even when you don't show symptoms, to people who can get seriously ill. So we really are entering a time when everyone should assume that when we're in indoor closed spaces, there are both vaccinated and unvaccinated people who may not be wearing masks, and that there will be some risk. And each of us will need to be comfortable with the level of risk that we're willing to take. Vaccinated people will be at very low risk, but some may not respond to vaccine, and they may want to continue to take some protective steps like wearing masks indoors. And others may be not eligible for vaccine, like children at this point, children under the age of 12. And so they will need to continue to take precautions. So people will need to understand that as we transition from this phase of government mandates that were necessary to prevent the overwhelming impact on our healthcare system and to protect large numbers of people who are susceptible and who had no control over their risk, we're now moving into a phase where people do have more control over their individual risk and the individual behaviors. And so understanding what your personal level of risk is, what the level of risk is in your community, and taking steps to protect yourselves and others around you will continue to be important. I'll say a little bit more in the closing.
Thank you.
Thanks. Next, we have a question from community on social media. People are wondering about how long we can expect the current COVID vaccines to last. And there are some rumors or speculation that people would need to get a booster shot 6 months after completing vaccination. What can you tell us about that?
Well, we don't know. There's no reason to think that 6 months is going to be, the time when booster shots will be necessary. Basically, when these vaccines started to be used, there are people who are being followed up and it tracked to see whether or not they start to develop COVID-19 infections among vaccinated. And so far, we're seeing good protection. We're not seeing a decrease in the level of protection among the earliest vaccinated cohorts. And we'll continue to monitor over time. And when we start to see infections developing among vaccinated people, then we'll know it's going to be time to start thinking about booster doses. But right now, the limited data that are available suggest that protection from vaccination could last for a year or longer. And we'll only know with time for certain. It is important to know, though, even if you've had a previous COVID-19 infection, you can get significant benefit from being vaccinated, because adding vaccine will actually give you a broader level of protection against the new variants that are developing. So although I can't tell you how long protection will last for sure, that's one of the important unknowns going forward. I can tell you we're not seeing any warning signs at the moment that will that indicate that there's going to be a need for a booster at any particular time period, like 6 months. I would only say that if you've been infected, please do consider getting vaccinated as well to get a broader level of protection against these new variants that are significantly different than the ones that were circulating earlier.
Thank you. Next, we've got a follow-up question from Mayor Graywall.
Okay, Dr. Duchin, can you please tell us a little bit more about the reports of myocarditis being investigated by the CDC? What would be your advice to parents who are feeling concerned about vaccinating kids? And also, a lot of experts are recommending delaying the second dose. So is that something that you would recommend?
So, Mayor, I don't have much of an update more than what I shared last time, which I can review again. There have been a number of cases of myocarditis reported in the US and other countries, particularly after the second dose in younger people, more common in males than females. By and large, these cases of myocarditis have been characterized by the healthcare providers as mild, meaning the patients either did not need to be hospitalized or were hospitalized very briefly, mostly for diagnostic testing, were either treated with anti-inflammatory drugs or not treated and recovered. In contrast to the type of myocarditis that we're used to seeing from viral infections, including from COVID-19, this appears to be somewhat different in that it's milder. And the American Academy of Pediatrics, the American College of Cardiology, and the advisory committee at CDC are all convinced, as am I, that the risk of COVID-19 vastly outweighs any risk from myocarditis. COVID-19 itself can cause myocarditis, as well as a range of serious complications in people of all ages. We're still learning a lot about the long-term impact of COVID-19. We know you can get long COVID even with a mild infection. You're more likely to get serious long COVID symptoms the more severe your illness is. We're learning about the effects of COVID on all organ systems, including the lung and the brain and nervous system. So there's a lot we don't know about this disease, but everything we do know suggests that we should be doing everything we can to avoid getting it. And the risk of myocarditis, although appears to be real and is being characterized, and there was a meeting that was scheduled today at the Advisory Committee on Immunization Practices that was postponed because of the federal Juneteenth holiday being established, will be held next Wednesday. And at that time, there will be updated presentations on the national numbers with respect to how many cases have been reported, what the risk is, and the risk benefit. But I can tell you based on everything I know and everything I've seen, the risk of COVID-19 still greatly outweighs any risk from the vaccine, and that, as I mentioned, the American Academy of Pediatrics and the American Academy of Cardiology and the CDC are still strongly recommending vaccination.
Thank you so much, Dr. Duchin.
Great. And then we have a follow-up question from Jessamine McIntyre.
Hello again, thank you. I had a quick question when it does come to children as we're going back to school in the fall. Are there any studies you can give us an update on for those under the age of 12 that might be occurring in King County? And if so, do you have a timetable, or are you given any timetables on when a US vaccine for those at that age group might be approved?
Yeah, so I'll start with the second part. It seems that, best guess is that there might be a request for the FDA to review a vaccine for younger children, school-age children, perhaps this fall or late summer, but we don't have an exact date yet. So likely, there would not be vaccines widely available before the new school year started. With respect to studies, I mean, Jessamine, we can follow up with our case and incidence rates. Clearly, the highest incidence, the greatest risk for new cases is in younger people, and it really goes linearly with age now. Our older people are most protected and less likely to get infected, and our younger people are more likely. That ranges from, adolescents all the way up to adolescents and school-age children all the way up to, young and middle-aged adults, and then least risk for the older adults. I'm not sure, when you say studies in King County, if there's something else that you were referring to.
I just know that the other age groups, 12 to 17, was studied before they were approved. There were some UW clinics. There were some separate pockets of those vaccines being tested.
Oh, I see. Yeah. So some vaccine studies. Yes. Okay. No, I'm not aware. I'm not aware of any specific vaccine studies being done in King County, but there are. It's possible that there are King County residents who are participating in national studies, for these vaccines, the Moderna vaccine in the younger people, or the Pfizer vaccine in the younger people. But those are national studies that people may enroll in through healthcare providers that are based in the county. But the numbers would have to be aggregated across the country to have enough information to draw any conclusions.
Thank you very much.
All right, that wraps it up for questions today. So Dr. Duchin, I'll hand it to you for final remarks.
Well, thanks everyone again. It's been a minute since we had a chance to talk, and we're thinking about how frequently these updates might make sense as the outbreak stabilizes a bit. We are in a much better place today than at any time since the pandemic started, thanks to these highly effective vaccines and to everyone that's come to be vaccinated. That's the way we will return to healthier lives and a healthier economy. But it's important to understand that COVID isn't over. COVID-19 has been suppressed but not eliminated. More contagious variants are spreading, and we need to take them seriously. As we move into summer and fall, we also need to keep in mind there is uncertainty around the impact of changing behaviors and increasing activities associated with reopening Washington, about the new variants of concern and the duration of protection from vaccination, and other things we still don't understand completely about how the virus spreads. So I recommend going forward with both optimism and caution and humility about predicting the future. We continue to depend on one another for community protection. The bottom line remains that the more people that are vaccinated, the less COVID-19 will circulate and the safer we will all be. Other protective measures, including wearing masks by the unvaccinated and by everyone in certain settings, improving indoor air quality, and getting tested as needed, will continue to be important for the foreseeable future. And in particular, continuing to focus on improving indoor air quality in businesses, workplaces, schools, and other public settings through increasing ventilation and the use of filtration technologies should be a top priority. And finally, I'd like to close with a quote from Martin Luther King Jr. that I think resonates both on the observance of Juneteenth and in the context of our COVID-19 outbreak. And that is, injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. With that, I'd like to thank you again for joining us, and I look forward to talking with you again in the future.
Thank you so much, Dr. Duchin, and thanks to the media and community watching on social media today. Bye-bye.